नमस्कार सासंग जी वाहिगुरु जी का खालसा वाहिगुरु जी की फतेह. We thought it'd be easier if we had the secretary, our current secretary of Health and Human Services here, Dr. Dave Sangwai. It's an honor to have him here today. He made a special trip from Raleigh to come to kick off our meeting tonight. We'll do the speech here, and then there's a bunch of stuff ready outside. But we thought this would be less disruptive to the overall program, which is already hard to corral. So Dr. Deng Bai was, as a family medicine physician, he's from my alma mater, Duke University, and now he has taken an incredibly multiple leadership roles in family medicine, community health, and in a number of different areas, including in the Raleigh area. And now he's the first Indian serving under the governor in the state of North Carolina. And so to have a physician leader make the time and effort to come out here and to help kick off our North American Sick Medical Dental Association 2026 meeting is a huge honor, and we want to thank him so much. And thank Aaron also for making the trip. We look forward to hearing from you.
Great, thank you very much. Thank you, Jasmal. So it's really a pleasure and honor to be here today, and I want to first start by congratulating the organization. As I understand, it's been 30 years, but I think it's wonderful that you put an organization together that's really thinking about how do you not only bring physicians, but dentists and others from all aspects trying to think about how do you actually improve community health. So it's really an honor and privilege to be here, and I hope I didn't interrupt your program in order to be here, but it's really unique that we get to celebrate such a joyous and momentous thing happening here in the Charlotte area. So my background is interesting. I think what I saw coming in as I was walking into the building today is a number of early in career individuals in college, maybe in graduate school or early in career. And what I think one of the most important things is we need more individuals of South Asian descent in leadership positions. And I was really fortunate when the governor asked me to take this job, because what it's allowed me to do is to bring my experience not only as a North Carolinian, I live in the Durham area and I've been living there since 2001, but also the experience as a physician, as a South Asian, to really think about how we improve community health. And so I think it's really impressive that you're doing the work that you're doing. I had a chance to see the program, and I'm sorry I'm not going to be able to join you for most of your meeting, but it really looks like you have a very robust program planned as well. One of the things that I learned so it's been just about a year in this job, and one of the first things I learned is the power of listening. And I think we know that as physicians that we have to spend much of our time listening to patients, but I've found that the opportunity that comes in government when you have an opportunity to listen to people and really understand what's on their mind. And we have a lot going on in North Carolina. A number of things that's going to impact the South Asian community, a number of challenges we have. I know for those of us who take care of some of the most vulnerable patients, we have a challenge with funding our Medicaid program in North Carolina. There are 11 million people who live in the state, 3 million who rely on Medicaid. And right now, we do not have enough money in the budget to see it come through to the end of the year. So we're working hard to get the General Assembly, those who actually help appropriate the dollars, to help us better understand how we can get the additional funding that we need. We also have 1.4 million people in North Carolina who do not have enough money to feed themselves. 1.4 million out of 11. And I think it's only fitting that we share that statistic in a facility like this, because there's so much that I know that is part of the Sikh tradition to ensure that the hungry get fed. And you have probably witnessed it firsthand more than any other community, but that's what we're dealing with in the state. They all rely on federal dollars to help us allow them to eat. Those federal dollars are also at risk, and so we're working hard to make sure that we don't lose those dollars as we're trying to figure out how do we make it so that individuals can also continue to eat as well. A couple of things I've also learned in the power of listening is to just visit. So I appreciate the opportunity to come here today, because you really want to go to where the people are when you're really responsible for figuring out how to manage their health and wellness. So those ideas have really been helpful, and I think to myself, you have to be a good listener, you have to understand where people are coming from. And so as I think about the many roles that I've held, the role as a physician has probably been the one that's helped me most in being a Secretary of Health and Human Services, because it's really given me an opportunity to think about those things that we do when we listen to patients, we understand where they're coming from and the problems that they're facing day in and day out. The challenges in North Carolina are pretty significant. We have more challenges than I just talked about, but we also have some really good things that are happening. About a year ago, we started a process to eliminate medical debt. We were able to eliminate $6.5 billion of medical debt. This is debt that individuals were carrying in their medical balances, balances that would oftentimes make it difficult to get car loans, balances that would oftentimes make it difficult to get mortgages. We worked with all the parties involved, particularly hospitals, to find a way that the hospitals would write off that debt. And so what we now have is $6.5 billion of debt that the hospitals are not going to try to go out and collect. Again, another great example of how when people come together, we're able to think through the challenges that we have. We also have a very rural state in North Carolina. And it's great that we're in a place like Charlotte. I had the opportunity to drive here from Durham, but the most of North Carolina is a very rural community. And so we were very fortunate that we have been recently granted a large sum of money from the federal government called the Rural Health Transformation Fund, which is really designed to better understand how we improve rural health care in North Carolina. So we're going to use those dollars to help community organizations. We're going to help use those dollars to help understand those entities that are deep in the community that are having an impact on community health. So as we look across the state, it's organizations like this that can help us figure out where can we have the biggest impact with those dollars that we have. There are so many other things that we can talk about as we think about what's going on in North Carolina, what we can do to improve the health of North Carolina. For me, it's always been about the people. The opportunity to go around and meet the people throughout the state to really understand what's top of mind for them. And right now, as many of you know, there are a lot of challenges individuals are facing with respect to affordability, respect to access, respect to insurance. And we have some other challenges that we're going to have to face when it comes to health insurance. I talked about the 11 million people who live in North Carolina. There's about 3 million people who rely on Medicaid in order to get health care in North Carolina. And North Carolina does something very unique within health care. We actually pay for dental care. In many states, Medicaid doesn't cover dental care. But it's those types of benefits that become at risk when we have insufficient funding to be able to do the things that we need to do. We also have a challenge when it comes to the things that we're trying to do, as I mentioned, in the rural communities, those things that we need to do to improve rural health. Those are all a part of what we're trying to do in North Carolina. So I don't want to spend all my time talking about all the challenges and problems. I think when I look at the kind of schedule that you have before you coming up for the next 2 days, when I think about the type of impact you're trying to have on the community, I think you're setting the example. How a group of like-minded individuals, deeply grounded in faith, deeply grounded in the support of people, deeply grounded in making sure that all people are taken care of, really helps us understand what we can do to help North Carolina. So I don't want to take too much more of your time. What I will say is that I, again, am really thankful for the opportunity to be here. It was wonderful coming here. I look to the opportunity to meet several of you as we spend a little bit more time here. But this is your opportunity to help us better understand what we need to do to improve health in North Carolina. We want to make North Carolina the healthiest state, and we want to make North Carolina a place where people can grow and thrive. And I'll end on some people will often ask me, how did I get this job? How did I get a job to be a cabinet secretary? I literally applied online. I did not know the governor beforehand. I had no political connections beforehand. We know that political donations sometimes matter. I didn't even donate a single political dollar. But somehow, a year ago, I get a call after interviewing many times, and he offered me the job. And we resonated on one point. And I think, again, it's a point that is so powerful with the Sikh culture. And that is, everyone should be entitled to good health care, regardless of where you live or how much money you have. And he and I connected on that one theme, and I think that's such a big part of this community. So I'm excited to be here. I'm excited to meet you. Jaspal knows how to reach out to me. I encourage you to continue to share with me the ideas and things that are top of mind for you. Let's make North Carolina the healthiest state in the country. Finally, I know many of you may not be from North Carolina as you're visiting this fine state, so we hope you have an opportunity to experience all the great things that North Carolina has to offer. But the challenges I mentioned are the same throughout the country. They're no different anywhere else. But if we can serve as an example, if we can serve as a place where individuals can learn those best practices, where we're happy to do that, and then we're also ready to listen and learn from others. So thank you again for the opportunity to be here. I'm sorry if I interrupted your program. I'm going to stick around for a little bit, but the best thing we can do is to shake hands, make friends, and start those new connections as we try to figure out how to make things a better place. Thank you, everyone.